Good morning from the Oklahoma Insurance Department. My name is Rachel Fan, and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Mondays webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you can't reach an agreement regarding a claim. If you would like to reach out to us for help, or if you have any questions, you can call us toll-free at 1-800-522-0071, and you can also visit our website at oid.ok.gov. For today's webinar, you will be able to see and hear us. However, we cannot see or hear you. If you have a question, please type it in the chat. At the bottom of your screen, you will see several options, one of those being chat. And if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now I'd like to introduce our speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience working in and around the healthcare industry, primarily in insurance, and has had the privilege of speaking to groups across the state and around the country. Ray, over to you.
Thank you guys for joining us this morning. I hope you're enjoying this cooler weather. Wanted to remind you that the Medicare Assistance Program is funded by grants through the Administration for Community Living that provides us with funds to go out and educate people about Medicare and what their choices are related to Medicare and what are the things they need to consider about their Medicare coverage. So we are located at the Oklahoma Insurance Department, and we're there to help all of the consumers of Oklahoma with their questions about Medicare. So the topic for this month is common open enrollment notices. As you know, we're getting into that time of year when people are going to need to make decisions about their coverage for the coming year. So we want to go over some of the things that consumers need to be watching for so that they can make educated decisions. The Medicare Open Enrollment Period, as most of you know, runs from October 15th through December 7th. And this is a specific time period for selecting, reviewing, enrolling in Medicare Advantage plans and Part D prescription drug plans. So it really doesn't involve other insurances, even though they use the term open. It's for Medicare Advantage plans and Part D prescription drug plans. The Medicare Advantage plans are those HMOs and PPOs that are offered by private insurance companies, and the Part D plans are those prescription drug plans. So this does not apply to Medicare supplement insurance. We're going to talk a little bit more about those options in a couple of slides. So this is the time to review your current coverage, your current medications. Have they changed over the course of this year? As well as the physicians and other providers that you see or may want to see in the coming year. So we want you to review the available plans and see if there's a change that's going to be right for you. Maybe switching to a different MA provider or something like that would put you in a better position. So getting ready for the Medicare Open Enrollment Period, what are the steps that you need to take to get ready? First thing we want you to do is to review your current coverage, as well as any additional coverage you may have. First off, are you still employed? Maybe you're somebody who's not quite on Medicare yet, or you're still working, or your spouse is still working, and you've got health insurance coverage through that employer. If that's the case, you don't have to get enrolled in Medicare yet. You can delay enrolling in Medicare and just continue using your employer health coverage. Why that might be to your advantage is that while Part A is premium free for most people, you have to pay for Part B, which is $174 and change for this year. We don't know what it's going to be for next year, but typically it does tend to go up. So that's one opportunity. Secondly, are you a veteran? If you're a veteran and you've been getting your health care through VA, that's great, but be aware that, as you probably already know, VA only works within the VA system unless VA refers you out for care. So if you're somebody that might want to utilize care outside of VA, it might be worth your while to consider getting enrolled in Medicare or some other related plan like a Part D prescription drug plan, just to expand the care that you can receive. TRICARE. TRICARE is the insurance for active duty military and their families. And if you retired or you're about to retire, that's going to flip over to TRICARE for life, in which case you will have to have Medicare Part A and B, but it's really great coverage. So in most cases, for someone who has TRICARE for life, they really don't need to look at getting a Medicare Advantage plan or a Part D prescription drug plan, because they're going to find that that coverage is already provided through that TRICARE. If you have access through Indian Health Services, this is another coverage that can provide you both health as well as prescription drug coverage, but it might be to your advantage to consider looking at getting into a Part D prescription drug plan to expand the number of medications that might be available to you, as well as it provides another payer for your medications so that it doesn't put such a burden on IHS to cover all these prescriptions. The other thing to keep in mind, do you currently have a Medicare supplement insurance policy? And if your intention is to retain that Medicare supplement insurance policy, you really should not enroll in a Medicare Advantage plan. That the two of them do not work together. The Medicare Advantage plan is more or less going to cancel out the coverage provided by the Medicare supplement insurance. So your Medicare supplement insurance would just be sitting there. You'd be paying premiums, and the Medicare supplement policy would not be paying for any claims. Now, you would still need a Part D plan to cover your prescription drugs, because Medicare supplements don't cover prescription medications. So you want to make sure that you are taking a really good solid look at what your current coverage is, because any changes that you make could impact that current coverage. If you've got any questions about that current coverage or the impact it could have, any changes could have, give us a call at the Medicare Assistance Program, and that number is going to appear here in a few slides. So, I told you earlier we were going to mention something about Medicare supplement policies, because this is really important. We've had a number of people who, because their monthly premium for their Medicare supplement insurance has continued to increase over the years to the point where they're paying a significant amount of money, those individuals have been put in a position where they've really had to consider, do I need to make a change to some other type of Medicare coverage? Beginning at the end of 2023, Oklahoma passed what we call the birthday rule. And what it says is that every year, for any Medicare beneficiary who currently has a Medicare supplement policy, has a 60-day open enrollment period that starts on their date of birth, or on their birth date, I should say. And it gives them 60 days during which they can shop for and purchase a different Medicare supplement policy of equal or lesser benefits. So if a person is on let's say, Medicare supplement plan F, and the premiums have gone up and up and up every year, and they would like to make a change. Well, prior to this birthday rule being passed, it was very difficult for those people to get into a different policy, because the insurance carriers were allowed to request medical records and to look at past health history. And if a person had, let's say, heart attack or cancer or something else in their history, an insurance carrier could actually deny them a new policy or increase the premiums. It was just made it not worth their while to try and seek another policy. Well, now, thanks to this new birthday rule, those individuals have this 60-day period where those insurance carriers can't impose those requests for the insurance records, for the health records, excuse me. And it's a really good opportunity for them to possibly save money on their monthly insurance premiums. So anybody that needs more information about that, don't hesitate, give us a call. We would be happy to share that information with you. We can also run you a quote of what those premiums might look like if you were to make that switch. But be aware, it's a 60-day period. It starts on your birth date. And once that period is over, you have to wait till the next year when your birth date comes around again. So let's talk about some of the notices that you're going to receive prior to the open enrollment period. These are really important notices, and I know you're going to be hammered with a lot of mail starting in the fall, but you got to pay attention to this stuff. It is definitely to your benefit. They're going to start arriving this month, and they're going to provide you information about your current coverage. So it's going to tell you about the coverage you've got now, but it's going to tell you what it's going to look like for the coming year, any changes that are going to take place. So make sure you're paying attention. Now, the two main ones that you're going to receive are the annual notice of change, also called the ANOC letter, and the evidence of coverage, or the EOC. These are documents that are sent by your current Medicare Advantage plan or your prescription drug plan, and you should be getting those before the end of this month. If you don't get them, contact your current plan and say, hey, I haven't received my annual notice of change or my evidence of coverage, whichever document we're talking about. And just as the names say, these are going to tell you anything that's going to be different for the coming year. So it's going to tell you things such as, is the monthly premium for your plan going to change? Is the deductibles for your plan going to be different for the coming year, as well as any co-payments that you might have to make? You might be on a plan now that doesn't have a deductible for 2024, but they may be adding one for 2025. We know that for the Part D drug plans, the maximum deductible is going to go up to $590. That's the maximum the deductible can be for 2025. The maximum this year was $545. So you want to pay attention if that's important to you to see, wow, the deductible's gone up on my plan. Maybe I need to check and see if there's a better option for me. The providers for a plan, whether we're talking about a Medicare Advantage plan or a Part D drug plan, can change. So if you've got certain physicians or hospitals that it's important for you to be able to continue seeing, make sure they're still going to be in the network for your plan. The same would be true if you've got a pharmacy that you use for your Part D drug plan. You want to make sure that that pharmacy is still considered in the network for your prescription drug plan, as well as you may have heard the term preferred pharmacy. A lot of times the plan will have a contract with specific pharmacies that give you better rates. So you want to make sure if you're in a network, if you're on a plan that has preferred pharmacies, that your pharmacy is still considered one of those preferred options. Another important change to be looking for is any changes to the plan's formulary. The formulary is the list of medications that are covered by that particular Part D drug plan. And there could be a change where a medication that you're taking is no longer on the formulary, or maybe it's gone to a different tier on that formulary, which means your out-of-pocket costs could go up. So definitely pay attention to the information about what medications are on the formulary and how much they're going to cost for the coming year. Some other important notices that we want you to pay attention to. If your plan is not going to be available for the coming year, you should receive a non-renewal notice, which should come before October 1st. And it just tells you that your plan is leaving the Medicare program for the coming year and that you need to make another choice. Now, if we're talking about a Part D drug plan, fine, give us a call at the Medicare Assistance Program. We would be happy to help you with making that choice into a different Part D drug plan. If we're talking about a Medicare Advantage plan that is not going to be available for the coming year, then that provides some other options. You can either move to a different Medicare Advantage plan, or you can return to traditional Medicare Parts A and B and enroll in a separate Part D prescription drug plan. The additional possibility there is to get into a Medigap policy. So this may open up an opportunity for you to have what they call guarantee issue rights to get into a Medigap policy without those underwriting issues that we talked about before. Another notice to pay attention to: if there is a plan out there that has not been performing well, In other words, they have their, as far as the ratings go within the Medicare system, they've got 3 stars or fewer out of the 5-star possibility. Then those individuals are going to be sent a notice that's the poor performance notice. And anyone that gets one of those, that means they're in a plan that received very low ratings for 3 or more years in a row. And those individuals are encouraged to look at the possibility of getting into a different plan that's offered in their area. So we've looked at all the notices. We've paid attention to that stuff. What are the things you need to do next after you've looked at the ANOC and the EOC and any other notices that you may have received? 1, do you want to get into a Medicare Advantage plan? If that's something that you're seriously considering. If so, which Medicare Advantage plan has the benefits that you want at the price that you want to pay? They're all very different. Not all of the Medicare Advantage plans are available everywhere. You may live in an area that has a Medicare Advantage plan that's working wonderful for you, but that doesn't mean that your best friend who may live up in Ponca City has that plan available in their area. So very important that we make sure that that plan is going to be available where you are at the price you think it's going to be available for you. Are the providers that you need to see in the network for that particular plan? Don't just pay attention to the costs. You want to talk to your provider. Don't just go by the website. Talk to your doctor. Talk to your specialist. Make sure that the hospital accepts that particular insurance, because it would be a very bad thing if you enroll in one of those Medicare Advantage plans and then try to go to the doctor and they don't accept that insurance and you have to pay out of pocket for it. Equally important, make sure that your prescription medications are on the formulary for any plan, including your Medicare Advantage plan, your Part D drug plan. It's very important that you don't just get in the cheapest plan out there. You want to make sure all your medications, all your doctors, everything needs to be within the network for the plan that you're going to get into. Next, before you make a decision, make sure that you talk to those providers. Ask them, I'm thinking about getting into this coverage. How do you feel about that? Do you have a good relationship with them? Are there any things that I need to consider? Sometimes they may have a perspective on it that you hadn't thought of in terms of lab work, physical therapy, something of that nature. So just be aware of what you're getting enrolled in and make sure that it's going to work for you in your particular circumstances. The same is true for your pharmacy. Talk to them about the same questions and stuff. Consider that your decision is going to impact, what impact that's going to have on your future coverage. Always take advantage of the Medicare Assistance Program at the Oklahoma Insurance Department. We're a state agency. We're there to help you. We don't get any money. We don't get any kickbacks from anybody. All we want to do is make sure that you've got the best coverage for yourself for the coming year. So lastly, once you figure that out, once you know what you want to do, then you're ready to enroll in a prescription drug plan. Now, it's very confusing. This year, I think there were 20 different plans that were available. We don't know how many plans yet are going to be available for next year. All of those plans are different in terms of the drugs they cover, the pharmacies they utilize, where they're located, all of that stuff. One of the primary services that we offer at the Medicare Assistance Program is we can simplify this process for you, because we can actually review your current drug list with you, the pharmacies that you want to use, and we can give you a list of the plans that would be available in your area for the coming year, as well as the costs associated with those plans. And we can help you enroll in that Part D prescription drug plan. Last year, the Medicare Assistance Program at the Oklahoma Insurance Department, average savings for the people that we assisted with this process was over $3,000 for the year. The total savings was over $4 million. So this is a service that we're happy to provide to all beneficiaries, so please take advantage of it. Now, when it comes to Medicare Advantage plans, we can do that same sort of comparison with you. We can look at your medications. We can help you figure out what plans are available in your area. But when it comes to talking to the providers about them taking that insurance, you'll need to do that conversation yourself. And when it comes to enroll in a Medicare Advantage plan, we cannot by law in the state of Oklahoma, enroll you in a Medicare Advantage plan. That would have to be done by a licensed insurance agent, or you can do it yourself. Now, when it comes to working with an agent, independent agents and brokers, they're selling these plans. They've got to be licensed by the state of Oklahoma. Each plan has to tell the state, in this case, Oklahoma, which agents are selling their plans. And if you're going to meet with an agent, the agent's got to follow all the rules that Medicare has set up for these specific meetings that you're going to have with them in terms of what they can and cannot do. Now, what an agent can do, they can make an appointment if you request one. They can't cold call you. They can give you plan materials. They can tell you about the plan options and how to get more plan information. They can give you an enrollment form as well as collecting that enrollment form once you've completed it. And they are allowed to leave business cards for you to give to friends and family. They can't ask you for the names of friends and family for them to contact, but they can leave cards in case you want to give them out. A few other key points to remember. One, don't enroll in a plan based solely on their supplemental benefits, things like dental coverage, vision, hearing, or those new purchase cards they've got. We've had a number of people that have called us this year that were very frustrated because while the dental, vision, and hearing are nice to have benefits, they're not the primary purpose of healthcare coverage. There are other healthcare benefits that are much more expensive as well as more important to your life. So yes, dental, vision, and hearing are great add-ons, but make sure that the primary coverage is going to give you the coverage that you need. And just as we talked about with healthcare coverage, talk to your dentist, talk to your vision provider, talk to those providers and say, hey, what do you think about me getting on this coverage? Do your own research, look for reviews online, or talk to family members. If you're not someone that likes to use a computer, have them do some research for you. We've already talked about talking to the doctors in the hospitals. Talk to your friends that live in your area. Now, keep in mind, just because someone lives across the street and they like the coverage that they've got, that doesn't necessarily mean it'll work for you. It's important, their opinion works, but also make your own decision. There's our phone number again. I guess I'm really stressing that this time, aren't I? Now, after you get enrolled in your coverage, you'll get a notice that says, okay, your application has been received, but you still want to be paying attention to make sure that you get the information in the mail that says you are now enrolled in XYZ plan. You'll get something in the mail that will include ID cards. So if you're enrolling in a Medicare Advantage plan, you'll get an ID card for that. If you're enrolling in a Part D prescription drug plan, you'll get an ID card. Very important you take that ID card with you to your next medical appointments, pharmacy, whatever the case may be, so that that provider makes sure that they're billing the right the right insurance provider. So make sure it's the plan that you expected. We've had a number of people this year who they enrolled in one plan and they may have spoken with someone from another insurance that represented another, let's say, MA plan, and somehow they wound up getting enrolled in that second coverage. It wasn't the insurance that they thought it was going to be. We need to catch that as early as possible. We can correct it in most cases, but it's got to be done very, very quickly, or you could find yourself stuck in that second coverage. Now, watch for materials that you didn't expect. Like I said, if somebody accidentally enrolled you in a different coverage, make sure that you don't see something from that coverage that would indicate you got enrolled in the wrong coverage, or maybe if you're looking at your Medicare summary notice or an explanation of benefits, you don't see something that somehow implies that you're actually enrolled with a different carrier. Now, before we go to questions, I want to remind everybody, with open enrollment coming, these are the agencies around the state that work with us at the Medicare Assistance Program to provide counseling and enrollment assistance in their area. So all of these agencies here also listed are the counties that they provide assistance to and their phone numbers. So please, if you would like to talk to someone who's closer to home, feel free to reach out to these people. They're typically they're familiar with the Medicare Advantage plans and Part D drug plans around their catchment area, as well as the hospital systems. So now, Rachel, if you'd like, we can go to questions.
Yeah, so it doesn't look like we have any right now. Just a friendly reminder, everyone, if you do have a question, go ahead and click on that chat icon and type it there, and we will be able to answer your questions accordingly.
While you're doing that, I'm going to remind you, we do have 3 more Medicare Mondays coming up for this year. In October, we're going to talk about getting ready for open enrollment. Open enrollment starts October 15th, but unfortunately, you're going to start getting a deluge of mail October 1st. So let's talk about, what are the things that you need to do and how to protect yourself from the more aggressive, not necessarily salespeople, but there's some telemarketing things that we're going to talk about. Then in November, preparing for future healthcare needs. And then in December, we'll talk about the specific changes that we know are coming for 2025. So there are going to be some changes there.
So, Ray, it does look like we have a question that's just come up. Someone wants to know if it's possible to meet in person with one of the MAP counselors at the Oklahoma Insurance Department.
Yes, it is. You would call that same 800 number and tell them that you would like to set up a in-office appointment to speak to one of our counselors. And probably would be a good idea, even though if we're talking about a change for 2025, we don't know what those changes are going to be yet. We will have that information after October 1st. So I would recommend going ahead and calling now to make an appointment, but don't make the appointment until after October 1st at least, maybe even after October 15th, because we won't have that new information for you. Now, if you're wanting to speak to someone about a change that you need to make for 2024, by all means, call and schedule that appointment and you can speak to a counselor.
Wonderful. And that is it. That's all the questions we've got.
Hey, well, thank you again, everybody, for joining us. We hope you will take advantage of speaking with us again next month. You can enroll in that by visiting map.oid.ok.gov. So with that, I will bid you all a happy Monday and go out and enjoy this weather.
Thanks, everyone. Bye-bye.